Let's see if I can teach you how end-stage renal disease absolutely destroys cardiac function. Hi, my name's John. I'm a nursing professor, and I also have been an ICU nurse at the bedside for 10 years now. Wow. And I am also an artist, and I love drawing concept maps and just funny, crazy things that are associated with nursing. I'm going to take a big breath and see if I can just crank this out. So, end-stage renal disease and cardiac function. You're going to have volume overload from those failing kidneys that can't excrete water and sodium. This leads to hypertension, pulmonary edema, and ventricular dilation. Maybe slow down a little bit. Chronic preload strain, which is from left ventricular hypertrophy, and this is going to eventually lead to heart failure. Electrolyte and conduction abnormalities, you're going to have hyperkalemia, which is noted by those peak T waves and widened QRS. This might lead into VFib from those life-threatening arrhythmias. Hypocalcemia, hyperphosphatemia, you're going to see those prolonged QT intervals, and this also increases your arrhythmia risks. Metabolic acidosis, this further destabilizes conduction of your heart. You might see uremic cardiomyopathy. This is from chronic exposure to uremic toxins and cytokines. And this is direct myocardial fibrosis and impaired contractility. Diastolic dysfunction is common, low ejection fraction. This is from those stiff, non-compliant ventricles. You'll have vascular calcification, secondary hyperparathyroidism and phosphate retention. This will lead to vascular and valvular calcification. You're going to have stiff arteries, which equals increase in afterload, which then equals worsening LV hypertrophy. You're going to have calcified valves, especially aortic stenosis. This is common in dialysis patients. You're also going to have anemia of end-stage renal disease because of low erythropoietin production, which will lead into chronic anemia, and then your heart compensates by increasing cardiac output. This is further going to exacerbate that hypertrophy, which is again going to lead into heart failure. And then finally, you're going to have blood pressure dysregulations because I haven't finished this, but kidneys normally regulate RAS, but they're not doing that anymore. Hope this helps. Follow along for more.